right, good evening, everyone. Those virtual members of the public, members of the Board of Trustees. This is a special call meeting of the Board of Trustees of United ISD. Today is Wednesday, August the 4th, 2021, and we are present at the UISD boardroom at 201 Lindenwood, Laredo, Texas. The time is 6:02 in the evening. I hereby call this meeting to order. Could I have for the record those board members that are present virtually, please announce your name for the record.
Davino is the third.
Alisa Vidaros.
Okay. Thank you. And those present, could you please announce yourself?
Frank Castillo, present.
Ricardo Molina Sr.
I am Javier Montemayor. There is a quorum. I hereby call this meeting to order. This meeting, let the record show that a quorum of board members is present and that this meeting has been duly called, that notice of this meeting has been posted in accordance with the Texas Open Meetings Act, Texas Government Code, Chapter 551. Will everyone please rise for the Pledge of Allegiance and Texas Pledge?
Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Honor the Texas flag, I pledge allegiance to thee, one state of God, one indivisible.
All right. Agenda item number 4, public comments. Do we have any public comments? No public comments. All right, then we'll move into agenda item number 5, discussion with Dr. Victor Trevino, the City of Laredo Health Authority regarding reopening of schools and the UISD health and safety protocols.
Mr. Montemayor, I think I've just got a text. I understand that Dr. Trevino is logging on. Oh, there he is. Great. But just for the board's background, we did meet with him, Superintendent Gonzalez, Ms. Rendon, Jaime, and myself, to discuss some of the opening of the protocols. And I know that Mr. Castillo was instrumental in putting this meeting together. So I'm not sure, Mr. Castillo, if you want to say a few words for this.
Yes, I do. Thank you very much, Mr. President, and members of the public and administration present. My name is Frank Castillo, obviously. I am the school board member for District 7. The reason I asked for this meeting was that I'm actually responsible to have Dr. Victor Trevino present with us, because I think it was important that the public and our community know, our standards know a little bit about what we're facing as we begin a new school year. So I want to start off by thanking Dr. Trevino for being present with us. I started to receive calls from the public, again, parents and constituents, about how we were preparing for next year. Many of you are aware that the rising numbers of positive COVID cases and the rising numbers of variants are also bringing a concern to many of us. So I do have a list of questions. At any time, if you think I should start, I can go ahead and start, or do we, how did we want to have Dr. Trevino first make a presentation?
I guess let's hear from Dr. Trevino.
Okay.
Good evening, Dr. Trevino. Welcome to our UISD boardroom. You're present virtually.
Yes, good evening, board members, superintendent, school administration, Dr. Victor Trevino, Health Authority for the State of Laredo. Thank you for having me.
Thank you, Dr. Trevino. You're here, members of the board are here, and we're getting ready to open up a new school year and bringing our kids back to our campuses. I understand you have, maybe some comments and some perhaps share some protocols that would help us this coming year.
Sure, absolutely. First and foremost, I would like to reiterate what has already been known for some time, that Laredo is medically underserved. It's an underserved community, which means that we don't have enough doctors or nurses. And that's been like that for some time, but it's accentuated with pandemic. And we do not have enough hospital beds also. primarily intensive care units for a community our size. And additionally, we're absent a pediatric intensive care unit. So critical pediatric patients are transferred to a higher level of care facility out of town if they become gravely ill. Currently, the hospitals are going on diversions on and off and are in a critical level with 0 ICU beds for the entire city for the last 2 days. And this is very concerning. But on the local infection front, even before school starts, out of the last 680 active cases reported yesterday, 252 were in the age group of 0 to 19 years old, which is consistent with the national data where COVID-19 cases in children and teens have gone up 84% in a week. And the Delta virus, which is the much more contagious and infectious variant, is now accounting for 93% of the cases in the last 2 weeks of July. So this is important information. When it comes to COVID-19, since the pandemic began, children represented 14.3% of the total accumulated cases. And for the week ending July the 29th, children were at 19% of the reported weekly COVID cases. And among states reporting, children have ranged from 1.3% to 3.5% of their total cumulative hospitalizations and 0.1% to 1.9% of all the child COVID cases resulting in hospitalizations. And with the reality of school openings, the number one question I get all the time is whether schools are safe, and which is better answered by how well the risk of COVID-19 transmission is mitigated and handled at schools. Just like it's currently unsafe to go to a mall or a grocery store without a mask, it would be the case to go to school without a mask. The creation of special considerations for immune-compromised and populations with comorbidities or underlying health conditions is also important. Now, this is a conversation that parents need to have with their doctor, and their child fits into this category. So the recommendations, I would say right now, would be to offer vaccinations to eligible students, surveillance testing of staff and students, enhanced ventilation, mask and face shield usage in highly density classrooms, isolation and quarantine protocols in order to stop large outbreaks, proper protocols in food service agents with a strong recommendation to avoid large gatherings of unvaccinated populations in cafeterias. And I would also recommend serving individual plated meals in the classrooms. And even when everything is done correctly, there may need to be a mandatory quarantine based on case-by-case basis to ensure that the community at large is protected. This is my introduction. I stand by for any questions.
Dr. Trevino, I know you have reviewed our health and safety protocols for United ISD. How do you view those health and safety protocols? Do our protocols, are they in line with what you're recommending to the public right now?
Yes, all the protocols you have done, I really commend you for them. They're really in line with CDC recommendations. Remember, CDC recommendations are the minimal requirements. I think everything is in line. We have to look at the cafeteria because we know that the CDC has recommended like large gatherings, especially mentioning cafeterias in school, is a high-risk area for transmission of COVID-19. So that's why the recommendation is to serve the meals in the classroom. Now, I don't know what kind of logistics that would pose, but that is a recommendation from the CDC, especially because we have unvaccinated populations.
Sure.
How about the boost? I was watching CNN this morning, and they were saying probably the next 2 weeks they were gonna probably start putting out the boost for this other the supplement for the COVID shots that the city gave. In other words,
Are you speaking about the booster?
Yes, sir.
Yes, sir.
Okay. There has been information that there will probably be a booster out there. It hasn't been authorized, and as an authorized physician to administer vaccine. We have not gotten that authorization yet. But studies are pointing to that direction. And this stands to reason that viruses do mutate. Just like the flu virus, you have to get a flu shot every year because the virus mutates and that capacity. So this is a virus we've been studying and the CDC has been studying. And where or when the booster will be required will come, and when it comes, we'll be sure to recommend it. So this booster especially is important for immunocompromised patients and patients that are undergoing immunosuppression, that's medications to diminish their immune system because of transplants or certain cancers. These are the patients that would be most vulnerable. So we have to just be aware that as it is for the general population, the current vaccines are still holding and they're still able to protect you from severe illness and or hospitalization. Yeah. So a condition called immunosenescence is also something to be aware of. Immunosenescence is the natural deterioration of the immune system as we age. So the older we get, the less strong your immune system gets. So this would probably hold true for people that are immunocompromised, and maybe the first people that would require would be the patients that are on immunosenescence.
I have one question in two parts, Doctor, before I pass the mic to Mr. Castillo. I had COVID, and I know a lot of people who've suffered through the COVID, and it comes in there's different symptoms, and there's different reactions for everybody's different. What are some of the symptoms of this new variant, the Delta variant, I believe that's what it's called? What are some of the symptoms that we need as parents that we need to look for in our children? I understand it may not be the same as the original COVID. And what about our special populations, for example, those kids who are going into our special ed units, those kids who may suffer from underlying conditions, maybe obesity or diabetes or some other type of immune disease type issues that we have. We have a huge population of that in our schools. How would we be able to make it safer for them? And what symptoms do our parents and our teachers need to look for?
Yes, the Delta virus is basically the coronavirus, but it has mutated and it's become much more contagious. And the symptoms are basically respiratory and multi-inflammatory symptoms, but the main ones are respiratory. Now, the difference between the Delta virus and the original coronavirus is the acuity, the rapidity of the progression of the disease. This progresses much faster, and the type of symptoms are much worse. The progression of the disease can cause rapid hospitalization, and we've seen patients that we have in a med-surg unit progress rapidly into the intensive care unit, and it wasn't like that before when the coronavirus initially started. So that is the problem with the Delta virus. It has become more aggressive and more contagious, and the progression of the disease is worse. Now, in regards to the special needs kids, a lot of them are immunocompromised, and special attention has to be taken to those children. Now, of course, the general instructions or the mitigations that we mentioned a while ago apply to everyone. But it is more important for these children because they have a tendency to be immunocompromised. So that is a very good point. So N95 masks are very important. If they can get a hold of N95 masks or double cloth mask or double surgical mask, and face shield would also help. Now, the masks initially were the single most important thing to prevent the contamination of the virus when we didn't have vaccines. And now we have learned that the virus doesn't travel in a straight line. It travels in like a wave pattern. And if you have a double mask, it is much more difficult for the virus to pass a double layer because of of how the way they move, and it's measured in microns. So all these things are important, and if we keep them in mind, I think we can do mitigations with knowing this scientific data before.
I wanted to follow up on that question because I was also concerned about the special education population and special needs population. When you say maybe possible double masking as well as face masks, do we include also the the professionals who work alongside of them?
That would be a good thing to do, because we know that a single layer mask may not be enough to stop all the virus. It will stop maybe some of it or half of it, but the best thing to do is to wear a double mask or an N95 mask. These are masks that are 95% effective against stopping the virus. And another important thing is that vaccinated individuals can also carry the virus. It was thought initially that if you were vaccinated, you did not carry the virus, but now studies have shown that even if you're vaccinated, you can still carry the virus enough to infect a non-vaccinated person. So that is why it's very important for everyone to use masks in indoor gatherings.
If a student is in close contact with another student diagnosed with COVID, how long should the student with close contact be out of school? Is there a recommendation from you?
Yes, if somebody's in close contact with somebody that is positive, and if the person was there for more than 15, 20 minutes continuously or in fragments, then the quarantine has to be done on that other person that has been in contact with positive. And the quarantine is 10 days. Now, the reason for that is because there's an incubation period. Even though initially the other person that was not positive and was in contact will not develop symptoms until an area of 4 or 5 days. So that's why it said that the person that was in contact needs to be in quarantine for 10 days. Currently, the CDC guidelines do say 10 days or after 5 days with a negative test.
And also, Doctor, just to jump in here real quick, this is Juan Cruz for the record. The CDC, I think on Thursday, sent an updated guidelines that if both kids are wearing masks, then at that point, then that quarantine period does not have to be there. So I think that they just updated that last Thursday evening, if I'm not mistaken. So if both kids are wearing masks, which is why we are recommending masks, that would avoid that quarantine period, for those kids in question.
Well, remember the CDC guidelines are the minimal things. So
Sure.
I would suggest otherwise in this situation, because we cannot determine if the other child is in an incubation period and will develop the disease. So especially if unvaccinated, which are children below 12 years old would be unvaccinated. So at this point, science is evolving and recommendations are given by the CDC. We follow them. We can do more than the minimal recommendations, but we should not be doing less.
So, Doctor, on that question, given a situation here at United, let's say a child in a classroom with 25 other children is positive, then the entire classroom must be quarantined, or a sports team, or a part of the band where there's a large group of people. Given those scenarios, which would probably be more realistic to us, we'd have to quarantine the entire group of kids.
That would go on a case-to-case basis, and if the children are vaccinated, it is not needed. But if everybody's unvaccinated, then we have to go and do it on a case-by-case basis. Remember, we don't have a pediatric intensive care unit locally. So we have to look at the situations, where they were outdoors or indoors, how distant they were, what kind of ventilation there was. A lot of things that come into play. But that is the reason why we are there to help. The health department is there, and I am the health authority, and these questions can be asked, and I would be glad to help you in a case-to-case situation. remember, no one shoe fits all. There's a lot of ins and outs. There's a lot of scenarios where the contact would be different, and the age of the children, and a lot of things. But I would be there to help you if you have any of these questions that you contemplate a quarantine, or you think that somebody was positive, how many children you have to quarantine, or if you have to quarantine the whole classroom. All these things would be on a case-to-case basis, and we would be glad to help you with that.
So I had questions brought to me, and one of the first ones was regarding your role and responsibility as the health authority. Dr. Trevino, can you please expound on what that role is?
Yes, the role of the health authority is a dual reporting role, and I'm an officer of the state, appointed by city council. I report to city council and report to the state officials on the level of infection. The role of the health authority is for prevention of diseases, quarantine of outbreaks, and food and waterborne diseases. And basically, it's the whole prevention of contagious diseases in the whole city. And when these situations arise, then the health authority is there to help and mitigate and even quarantine an area that has had an outbreak. And an outbreak is defined as 2 or more people breaking out with the same illness. Now, it is difficult sometimes to instill a quarantine, but a quarantine is not meant to punish anybody. It's to help mitigate and to help them learn what the infection measures are. And sometimes people can, or entities can self-quarantine with the guidance of the health department and the health authority. So that is basically the main role that we have.
If you determine there is an outbreak in a campus, how will you determine and make a decision to convey that information, perhaps to us or to the parents? How will that happen, Dr. Trevino?
Yes, my role is also information to the public, information to the entities, and I would provide all this information. Contact tracing, and school officials would have to be notified of this along with the parent. So everything is dealt with transparency and absolute guidance into how to get out of quarantine and how to proceed with these cases. And sometimes these are on a case-to-case basis because not everything is the same, and like we said a while ago.
So you could have that authority to tell the campus you do need to shut down temporarily, perhaps, or for 10 days because of an outbreak.
That's one of the measures. There's other measures,
Okay.
but that would be one of the measures.
And so when would the families, and I guess this also includes questions to our administration, when would the families become aware that it's okay to come back to school?
They would be informed, and I would provide that information. The health department would aid with that. And this is a coordination with school officials and the health department and the health authority.
Okay. And again, I apologize, the questions that I received were written in that form, and I did volunteer for so many words to go ahead and present the questions. I do think they're very important that we answer to the public and let them know what we're doing, and hopefully allay some fears about our protocols. I think our protocols are safe. I think they're very good. But still, the parents particularly and perhaps staff might have questions. So to continue with some of the other questions that were brought to my attention, so how do we actually know when a student, for example, or a staff member has the symptoms that have started COVID, being positive for COVID? Is there any guidance you can provide on us of what the symptoms to look for?
Sure. Initially, testing is very important because sometimes there are no symptoms and the test becomes positive. From there, we can start working. But if the child has not been tested, the respiratory symptoms is one of them: fever, malaise, coughing, abdominal pains. The children do not have as many respiratory symptoms as adults. So younger children also below the age of 8 do not have severe symptoms. So we have to keep that in mind. And I get several children with stomach pains. So their main symptoms are gastrointestinal or abdominal. So it's not necessarily respiratory. And this would apply to children below the age of 10 that would present not as many respiratory symptoms as older children.
What do we tell the parents to look out for in any student, particularly the age group of 11 and below? Is there any specific information for them?
Anytime they start having fever or respiratory abdominal symptoms, they need to go to their doctor and have it checked out. So in other words, do not send the child to school if they have any signs of illness, because coronavirus presents in many ways, respiratory, intestinal, and sometimes just mild fever. The symptoms are very similar to other respiratory flus or colds and coughs. So because we're in a pandemic right now, it is very important to decipher whether it is related to corona or not.
So would it be advisable if the parents observe these symptoms at home that they also alert the school personnel?
It's a good idea to tell them my child is sick. I'm going to take him to the doctor. He has low fever. So the school already knows when the child comes back if he was evaluated or the doctor gave him clearance that he does not have any signs or symptoms or testing for the coronavirus.
Would that clearance have to be in writing, Dr. Davino?
It would have to be a doctor's excuse to return back to school.
I'm going to change subjects just a little bit, but would you have data regarding how many hospitalizations are currently in Laredo for patients under 12 years old or younger?
We do not have a pediatric intensive care unit here, and all children that require hospitalization due to COVID usually have pneumonia and require intensive care unit, pediatric intensive care unit. So those children are sent out of town to other hospital, university, or Driscoll. So at this point here locally, we don't have any children hospitalized with COVID-19.
But would they report this to you as a health authority for this area?
Yes, they would. Yes, they would. And it's very important to keep tabs. It's reported also to the health department, where their epidemiologists keep track of all the infections depending on ages and time frames and all that.
And I think the questioner, the person asking the question was more concerned again for 11 and under. Like who's tracking that? Is that your office that does that? And would we have access to those numbers?
Yes, it is the health department, and Richard Chamberlain is the health director that keeps tabs on all those numbers. So his epidemiology group also has all that data.
Now, I wanted to ask a couple of questions regarding the mutations, the variants. How dangerous are those, Dr. Trevino?
The more any virus mutates or becomes contagious between one person and another, usually unvaccinated people, the stronger it gets, the more aggressive, the more virulent, and deadlier, of course. So the virus mutates and it adapts to conditions. That's what viruses do. So we have to keep ahead of the virus, and that's why we're constantly urging everyone to get vaccinated, because the virus thrives on unvaccinated people. Every time it goes from one person to another, unvaccinated, it gets stronger, it gets more resistant and more aggressive. So this is very important for unvaccinated populations, because it's not the same disease as when the COVID virus came about at the beginning last year. This variant is much stronger, more contagious, and actually more deadly. Now, children tend to do better. We know that children do not get as sick as adults, but things are changing, especially with this variants. Now children are getting sicker, and we see it on the data. We see young adults also dying that we didn't see before. All we saw before was elderly and middle-aged. Now we're seeing younger adults dying from coronavirus, and this is very concerning. The other thing we don't want to see is children dying. We have seen that in the United States that there's about a little bit over 500 children that have died from coronavirus. So we haven't seen that here yet, and we don't want to see it.
Dr. Trevino, how do you see the 12 and under vaccine coming out in the future?
I hope it comes pretty soon, and they had announced it was coming at the end of September, early October, but this is not for sure. But we're anticipating vaccine, and as soon as it comes, we're going to emphasize that everyone needs to be vaccinated. Everyone that is qualified for the vaccine.
Let me recognize Mr. Vélez. Mr. Vélez, you have some questions?
Yes, Mr. Montemayor. Dr. Trevino, Mr. Vélez, for District 4, thank you for joining us today, sir, and sharing your thoughts. My comments concerning the mask, I know we obviously hear from our district, we highly encourage the use of masks. You have done the same for our community and have spoken about it right now. But I think at the end of the day, the reality is that the mandate of wearing masks is not something that we can, that it's supported by the state. Has there been any dialogue from your part, your staff, with health authorities from the state concerning the issues that we're facing in our community because there's not a mask mandate? I know that's something that we cannot right now enforce because of the state information they put forward. So, has there been anything from your part that you've offered to the state? You know what, this is where we're at right now. I think mandating masks would be beneficial for our community, for our returning students.
Yes, absolutely, and we're constantly requesting that. I talked to the Texas Health Commissioner, Dr. Hellerstedt, and these concerns are brought up. These are executive orders.
Right.
And actually, that's a law. Basically, we cannot change it, but we can recommend it. And what we're doing is strongly recommending. And also, one thing that's very important: you may not be able to mandate the mask, but there is a communication with the parents that we can recommend to the parents to teach their children that they need to wear the mask. And it comes also from responsibility from the parents. They could help us tremendously. If they talk to the children and tell them you have to keep your mask or else you will get sick or get everybody sick here at home, that would help tremendously. I know your role is limited in regards to mandating it or even asking them to put the mask back on. But if they are already primed at home by the parents, that really would be very helpful. Just like just like wearing the seatbelts. You know, if we wear the seatbelts, I mean, it's law and everything. We have to wear them, and that comes from education. And now we put them on automatically. Nobody has to tell us. So this is something where we can prime our children at home, and the responsibility of the parents would help a lot.
Thank you, Doctor, for the comments.
Lisa?
Ms. Oliveros, you want to chime in here, comments or questions?
Yes, sorry about that. I don't know, Dr. Davino, thank you for joining us. I don't know if you're at liberty to say, but if you are at liberty to say, could you tell us what the youngest age was of a hospitalized patient with COVID? And if you are at liberty to say, what is the youngest age of a person who is now deceased because of?
Yes, we have seen children down to 3 months getting infected with COVID. So we have transferred children out of town, an 11-month-old child with COVID. And we have seen children intubated, not here locally. We have to send them out of town because we don't have a pediatric intensive care unit. But these are situations that do happen. So not because they're only 11 months or 3 months precludes them from infection. They can still get infected. But I am at liberty to say everything. You know, I don't try not to say names, but this is something that we can surely confirm that children below a year And especially if the mother's infected or if other family members are infected, they will get infected also.
Dr. Trevino, I heard this morning on CNN, President Biden criticizing Texas governor and Florida governor. If they don't pay attention to the president, you think they're going to pay attention to the city or to the school board? You know, that's my comment.
Question. But we have to educate and we have to persist, continue with the same message and do not deviate. We have to be transparent and continue saying the same information. We have to base ourselves on medicine and science. We know there's a lot of politics involved, but we try to not focus on that. Our duty is to do the medicine and the science. And I do want to emphasize that no plans are perfect, and we have to sacrifice sometimes. So we have to just continue the same message.
We've had a few more questions, Doctor, and then perhaps maybe administration, but we have some closing statements after that.
Thank you. I'll just continue. I got real quick questions. And that's exactly the point, that we're here to educate. We're here to educate the public, our constituents, and of course, our parents and students and staff. The question it was brought up was, can we, the COVID tests that we have right now, can they detect any variant at this time?
The COVID test detects the positivity that the virus is there. To confirm the variant, that has to be sent for a special lab for sequencing.
Oh, I see.
And that is another more tedious task, and it takes longer. The ones that we do here is the antigen test, which is a rapid test, and the PCR, which is a molecular test. That is a confirmatory test. So these are the two tests that are available here locally.
So I do have now my final question. Mental health. Very important that, of course, children, students have some social interaction. We're trying to balance that with the safety of our community and our students. Do you have any recommendations regarding how schools should address the mental health needs of our students and staff?
In regards to attendance to school, I'm an advocate that children need to go to school. I mean, that's for their development, for their social development and their mental health. It's very important that children go to school. But we have to balance this with public health. And sometimes situations are difficult, like right now. I know that your situation is difficult, but we have to do our mitigation in order to proceed forward. So the recommendations I gave, these are the ones of vaccinations, surveillance, mask and shield, isolation, quarantine, and proper protocols in food areas. These are the ones that we need to focus on. And the mental health in regards to children is very important. And we need to empower and evaluate the parents of the students to help us with this situation.
Dr. Trevino, how about the nursing homes and all these, what are they doing to look into like the elderly and the like Retama and all these other places that they don't get a lot of attention from anybody?
Well, we actually had a very, very intense situation when we started to see that a lot of residents were getting infected at the nursing homes, and it was through a public health order that we gave that we mandated that one nursing home become an all-COVID nursing home. So we know these are special populations, and I've been a medical director at one of the nursing homes for about 35 years. We mandated one nursing home to become an all-COVID nursing home and transfer all the COVID positive patients to this one COVID nursing home. This really helped us tremendously because it made the other nursing homes be free of COVID infection. And the ones that were all COVID were concentrated into one nursing home. And there we could continually test them and treat them and transfer them to the hospital if needed. But the concentration of one COVID nursing home really helped out the situation at the nursing homes.
We're gonna, I believe we have some staff questions also. Our Superintendent, David Gonzalez, is present, Dr. Torino. Go ahead, sir.
Dr. Davino, it's gratifying to understand that you recognize the importance of educating students, so I thank you for that. And for the work you've been doing in our community, we also thank you on behalf of our community. You mentioned a little while ago how your data indicates that there's a correlation with individuals who are not taking the vaccine, how the virus tends to go within them. You know, the correlation is stronger with people who not take the vaccine. And to support our community and our board members and yourself, at this time, 90% of our employees have been vaccinated within UISD. You know, we've been very fortunate that we're going to continue to promote the wearing a mask, you know, every single day. We're providing training to all our employees. All our employees are going to be required to complete employee safety training on the COVID mitigation strategies. We're creating specific modules for that. And I know this is all in the protocols, 50 protocols that our staff and the Guerrero Rondon have been working on for weeks now. And this is a working document. It is not something set in stone. We continue to get guidance from CDC, obviously from our state. And we want to thank you for the guidance we've gotten for you, Dr. Trevino. But as a district, we're going to continue to have offer every single student at UISD a death shield, as well as our teachers. You know, as far as indoor air quality enhancements, you talked about that as well. We're installed the MERV 13 high efficiency air filters in HVAC systems. We've also, as a district, have increased fresh air intake through our HVAC systems. There is no need to open the windows for that. And the district in the process of purchasing the UVC equipment for HVAC systems to assist in killing diminishing viruses, mold, and bacteria. Specifically with that, we're looking at all our special ed units, our most vulnerable students, and as well as our nurse clinics. By this fall semester, we will have this ability with these systems to eliminate as far as viruses and germs, so forth. And the goal is to have them obviously in all our classrooms. We're going to continue as a district to offer vaccines. You know, I'm glad to hear that we're hoping that the vaccine comes in for 11 years and younger sooner other than later. And we're going to continue to do everything in our power to enhance the safety of every single student and individual at UISD. I want to thank you for your time. I know we have other individuals here. I know Mike Garza is here with some other items. Gloria Rendon. Mike, you want to go next? Mr. Garza, excuse me.
Thank you very much. Mike Garza, Assistant Superintendent for the record. I just wanted to share with everybody because I don't want anybody to believe that we're just doing the minimum that the CDC recommends. We're actually doing above and beyond that. Mr. Gonzalez shared some of the items that we have in place. But just from a testing perspective so that y'all can understand where we're at, there's over 1,100 school districts, as you know. 800 decided to participate in the testing program that's being offered by the state. The BINEX testing is what it's called. UISD right now, as it stands, we are the 4th largest testing district in the state of Texas. So that tells you how much we're putting an emphasis on actually testing our students. As far as extracurricular activity, it is a mandated requirement to be a part of our extracurricular to actually get tested. We are currently testing every 3 weeks for every single extracurricular activity. We had at one point done it every 2 weeks. We've extended it to every 3 weeks because it is a massive undertaking. You're talking thousands and thousands of test kits that we're doing on a biweekly or in this case every 3 weeks. We have done other things. We've been doing the vaccine drives, the most recent ones, and everybody knows this. The city of Laredo has done a great job of vaccinating all its population, so the numbers are diminishing to the point that Curative, which was a city vendor, is no longer offering vaccines at their sites. Now they're just doing strictly testing. So the districts have taken on that responsibility to be able to do that. But just to give you a couple of examples, the last couple of vaccine drives that we've had a max of about 170 individuals sign up. So the demand or the want for it is not there in our community. We're making it available, but it's not as high as we had prior to it when we were starting it with over 1,000 individuals that we're vaccinating. We do have a drive scheduled for this Monday. It will be a second dose drive for 21 days ago. In addition, we'll do a first dose drive in that particular day as well. And then on Friday, right before school starts, we have another second dose clinic. and we'll do that as a first dose as well. So we're going to combine both to be able to get those individuals. To date, for Monday, we only have about 125 people signed up. So we're making the opportunity available for everybody and making sure that we're doing that. In addition, our custodial staff has been well-trained over the last school year to making sure that we're doing the enhanced cleaning measures that go beyond the CDC recommendations. So really, I just want to let everybody know, especially the public, that we are going beyond, above and beyond all the minimum requirements that are being available out there as well. And on a real note, I'm sorry.
Mike, I think it's good for the media, especially listening to this, for us to emphasize the percentage of the UIS employees that have been vaccinated. Could you repeat that for the
Yes, sir.
record?
As Mr. Gonzalez mentioned, we have over 90% of our employees vaccinated. At this point, quite frankly, anybody that has not been vaccinated is because they have chosen not to be vaccinated. It hasn't been for lack of availability. It hasn't been for the opportunities. Or if somebody wants to get vaccinated, as they get hired, they can go to our health services department, and our director of nursing will vaccinate them on the spot. So it's very critical that we let the public know that those are available to us. One quick note also, at the start of the year, we were anxiously awaiting obviously when the vaccines came out, it was available for 16 and above, right? So we were anxiously awaiting the 12 and over vaccination, which was at the time told to us that it would happen sometime in August. So we were anticipating right before school starts to be able to vaccinate those individuals. Well, thankfully, they advanced that to May. So we were able to vaccinate 12 and over prior to the end of school. In addition, they have talked about the 5 and over vaccination opportunity by the end of the year, which is in December. We're anticipating, we're hoping, as Dr. Trevino mentioned, that gets advanced to September, just like the 12 and over has as well. Just to put everybody at ease, we have over 7,000 vaccines available right now in our possession to be able to, as soon as we get the word, we can vaccinate by the next day. So we're prepared to do that. We have the infrastructure, we have the staff, and we have the everything set up to be able to do it within the next day.
Mike, would you be able to tell us how many is the actual number of employees? You said 90%, but I'm trying to figure out what would be more or less the number.
Just to give you a rough estimate, we
Yes,
have
yeah.
close to 6,500 employees.
Okay,
So 90% of that will probably put us around 6,000 or 5,800 vaccinated individuals, fully vaccinated individuals. So,
Which is more than the average.
yes, sir.
And there might
There's a-
be
Yes,
some
sir.
employees that do not get the vaccine because of medical reasons as well.
So, Doctor, I know you're short on time, but we'll probably wrap it up in the next 5 to 10 minutes. I appreciate your patience.
Good evening, board members, Dr. Trevino. I just want to emphasize the COVID teams, because I know, Mr. Castillo and board members, you were asking with regards to quarantine issues and need-to-know basis for individuals who are exposed to a positive or individuals who are positive. So what we're looking at is our nurse will do the assessments. Every campus has an RN, and so that the public will know that every campus is staffed with an RN, and we are looking at health techs in addition to that, so that they can assist with the COVID intakes and the mitigation practices. So individuals at the campus level who would show symptoms of COVID, whether they be respiratory, fevers or so forth, stomach issues, they will be isolated into another area, into another room, and the parents would be called. And so they would be in this holding area away from everybody else with regards to moving the individual as to not infect any other individual. And so the nurse, of course, would make the contact. Parents would hopefully pick up the students, take them to the doctor, and that's when the doctor's clearance would come in if they're ready to come in, that Dr. Trevino mentioned. If they do test, they test positive, of course, that's when we start the intake information with regards to contact tracing, because that is important. Who was around the student? And so you asked, would we shut down an entire class? We asked teachers to do their seating charts in their particular areas. Who was exposed longer than 15 minutes or so? Were the desk shields up? Were they wearing a mask? And so forth. So it's on a case-by-case basis. And we would only notify the parents in this case of the individuals who were in close contact, and that's something that we need to work on. We are in the process of establishing our COVID team. Mr. Gonzalez did approve 3 additional nurses, or a total of 4 nurses, to join our health services department because they will be doing the contact tracing, 4 health techs or 4 clerks, and we are going by feeder pattern. If we need to, we will supplement those individuals, other individuals in that area if the workload gets a little bit too massive for contact tracing and so forth. And so they're the ones who would keep track. They're the ones who would clear. The campus cannot accept anybody back until that child is actually cleared through 14 days out, or a alternative method or alternative diagnosis is determined by the health services department. And that was approved by a doctor or so forth, that they bring us something else into into our area so that we can clear these individuals to come back. And so I hope I answered your questions with regards to how we bring these individuals back. We have to wait. They'd have to get, if they're positive, it's 2 PCR tests that we would require that they would be cleared until they return back.
Well, you've done excellent work, Ms. Rendon. Thank you very much. And Dr. Trevino, thank you so much also for accepting our invitation, and I'll pass this on to Mr. Montemayor now.
Doctor, I'll give you, let me just make a few comments for everybody who's listening's benefit. The district operates obviously under the Texas Education Agency, and they have mandated the opening of schools, face-to-face education. The district has been working hard since COVID first hit. When Mr. Vélez was president, he did an outstanding job, and we met consistently, continuously to address every single scenario, every single issue dealing with COVID, dealing with our employees, our students, how to make our campuses safe. This plan wasn't just born, last week. This plan has been in play for some time. We worked with Dr. Trevino, we worked with the city health department, county officials. Everybody's been involved. Our employees have done an outstanding job. The virtual technology has really, even though our students, learn better face to face, our virtual technology was a success. Every single employee, but not only that, and Dr. Trevino, you could probably talk about this a bit, but bringing back our students, and Mr. Castillo mentioned it a bit, they're also going to be going through some type of perhaps mental health situations. Perhaps they've experienced loss of a family member, they've experienced, some academic regression, social, emotional effects are going to be also there. It's not going to be quite that easy to bring everybody back in. This pandemic has taken away a lot from our community, and it's taken a lot away from families. These students have been affected by it, and so every department, we have psychologists that are employed by our district that are also going to be addressing these needs as well. So again, we're going to do everything we can, Doctor. We appreciate your help. We appreciate your guidance, and I'm really glad that you had the opportunity to address some of the members of our public who have questions. And we're going to make sure everything that in the classroom at the campus is as safe as possible. And we ask the parents to cooperate. We urge the parents to help UISD in making the campuses and the facilities safe. So with that, Doctor, I'll give you the final word.
Yes, thank you. Yes, absolutely, and I do commend the board for doing what they're doing. Information sharing is very important, and having a consistent message of safety first and transparency to the public always has been the best practice to avoid any panic of outbreaks. I think the public would appreciate, and they do appreciate, your information and your transparency. So with that in mind, I'll just stand for any information or any help or guidance that you need. And I do want to thank you for extending this invitation to me for discussing pressing matters on COVID-19 in our community and how it may impact school and health safety. So thank you very much.
Thank you, Doctor. Stay safe, sir. With that, we'll adjourn the meeting.